And this one?
It's a stir,
Yes,
because
this is the star
fluid is
pattern.
black, start is white.
Yes, very good. So the fluid is appearing, the CSF is appearing as bright. This and the fat is appearing as dark, which is completely opposite to the T1. In case of T1, the CSF would be dark, the fat would be bright. So this is completely reversal of the T1. So this is the star pattern. So next, most probably this is another link from the Radiopedia with respect to the terminologies. So you already know the basic terms, the planes. Okay, so we have the coronal plane. We have the coronal plane. Coronal plane is also known as the frontal plane. So if we cut across the ear, or in Bangla, this is also known as if we cut along the মানে কান বরাবর কাটলে যেটা সেটাই হচ্ছে coronal plane. So in case of coronal plane, if we cut across the ears, so dividing the patient into anterior and posteriorly, if we divide a patient into anterior and posterior segment, cutting through the ears, this is known as the coronal plane or frontal plane. Or also you can remember during the coronavirus attack or during the COVID, so we used to wear mask in the anterior portion of our face. So the COVID or coronal or frontal plane, it will differentiate into anterior and the posterior segment. So the coronal plane is a vertical plane perpendicular to the median plane, and it divides the body into anterior and the posterior part. So this coronal plane, this is also known as the frontal plane. Then we have the horizontal plane, also known as the axial plane or transverse plane, also known as the transaxial plane. So if we cut across the 90 degree, this is known as the horizontal plane. The axial plane, horizontal plane perpendicular to the long axis of the body. It divides the body into superior and the inferior parts. Then we have the sagittal section, also known as the longitudinal plane. So if we cut across the midline, so through the nose, so this is known as the sagittal section or the longitudinal section. Or alternatively, you can remember, so when we cut through the midway of the sex organ, this is the sagittal plane. So sagittal means the midway through the nose or midway through the sex organ. And if we go a little laterally, this is known as the parasagittal plane. So I think all the planes are clear to everyone. So coronal plane, if we are cutting through the ears, dividing anterior posterior, this is the coronal plane. The sagittal plane across the nose or midline through the body or through the sex organ. And this is the axial plane or horizontal plane. So next we'll be starting with the CT scan. Also, can anyone tell me the basic principles of CT scan?